Trying to get ready, started. Whoa, sorry. So hold on. We're out. So we do have an upcoming event. It's tonight, the fundraiser at Smash Burgers. If anyone wants to get a group, go over there afterwards. Again, you're supporting the club, especially going into next year. So we'd love to see you there. A couple of us e-board are going there as well. So you're welcome to join us. Some upcoming events. Again, SAVMA's over for this year, but Seaface does have a beach bash tomorrow from 5 to 7 p.m. in the performance hall. Yes. In the Ohio Union. And then again, merch is in. So if you order any merch this past semester, this semester, you can just go ahead and see Michaela after the meeting. She has all the remaining merch for this semester. So please pick that up before you leave for the year. We truly appreciate it. And then lastly, if you guys could complete this at some point, it would mean a lot to us. This is just a general interest form so that we can get a better idea of what you enjoyed in terms of speakers, meetings, social events, that sort of thing. So we can go ahead and plan more specifically to our group of general body members. Oh, sorry. All right, we will send it out in the group meet, and then ideally our last email next week. So I'll let Adriana know. Thank you for letting me know. Otherwise, without further ado, I'm going to introduce Dr. Caitlin Hepps Keeney. She's a current veterinarian at the Columbus Zoo and Aquarium. I won't spoil anything too shortly, so I'll let her introduce herself more. But we are so grateful to have her today. She's going to talk more about what she does at the Columbus Zoo in terms of wildlife, exotics, and yeah, sorry. If you want to come up here, I'll go ahead and get your presentation. Hey, everybody. Thanks for having me. So, like she said, my name's Caitlin. I'm one of the staff vets at the Columbus Zoo. And I'm going to be talking to you guys today a little bit about my journey for getting to zoo medicine, and then also just kind of the general pathways to zoo medicine that are not specific to me. And then I'll spend a little bit of time talking about some cases that we've seen recently at the zoo. And I left a decent amount of time for questions at the end if you guys have questions about any of the above or anything else that comes to mind. It's also meant to be pretty informal, so if you have questions as I'm moving along, feel free to stop me, but otherwise I'll just kind of give you some basic background information. So first step to becoming a zoo vet is what you're all doing right now, undergrad. So personally, I went to Johns Hopkins University in Baltimore, Maryland. I did my degree in behavioral biology, so kind of a mix of neuroscience and evolutionary biology. But as I'm sure all of you know, you don't have to do any one particular major to become a vet. You just have to meet a certain number of prerequisite requirements. And then it's all about kind of getting your experience in veterinary medicine, whether that's animal experience, vet experience, or research experience. I don't know how much that has changed in recent years, but at least when I was going through the process, there was a pretty big emphasis on veterinary experience. So getting time under veterinarians rather than just doing things with animals. So for people that are interested in doing zoo medicine, I would say prioritize whatever type of veterinary experience you can get, because it's very hard to get zoo vet specific experience as an undergrad. Not to say that you can't, but just in terms of getting your like main hours done, I would say that would be where to put your focus, and also just a good way to start getting some of your like basic fundamental grasp of medicine. So for me, I was a part-time technician at a local emergency and private practice in Maryland during the summers, and then during some of the later semesters of my college years as well. I also went on a service trip to Guatemala that did like spay-neuter programs. There are a number of those out there that I would definitely recommend if that's something that you're interested in. And then there should be photos here, but I think this was me also going to the Galapagos and doing like a tropical biology course during that time. So still doing things that were related to zoo medicine, although they weren't necessarily as like inherently veterinary at the time. And then you made it, you get to vet school, exciting. So for me, I went to Cornell, and depending on where you go, there'll be different levels of opportunity for you to be involved with exotics and zoo medicine. I know that Ohio State doesn't exactly have an exotics department, but there's still plenty of opportunities to get involved with the zoo, and there's a real partnership there, as well as, you know, other courses and opportunities, especially later on in your vet school. So in the beginning of your time there, I feel like I updated this today. Is there any chance that it's like a saved older version? No. Okay. Is it possible to pull it up just from the like Google Drive? Sorry. There are manatees on the shirt. Yeah, it's actually from the gift shop.
No worries, because I had noticed there's one other slide that was missing some stuff.
Yeah, I think sometimes it just doesn't like save from Google Drive well. But anyway, I think what I was, do you want me to not talk so that the microphone doesn't hear me? Potentially.
We'll take a brief break.
What is it? That looks updated. Yes, sorry.
All right, should be good to go. I don't know how to get that.
But oh yeah, the other thing that I had on the slide that I missed talking about was I spent a summer at the swine unit at Penn. So that counted as veterinary hours because I was working under one of the professors at Penn, even though it was partially veterinary, but it was also welfare research. And I think if you're interested in zoo medicine, getting involved in anything welfare related, even if it's not zoo specific, kind of shows that you have that interest early on, especially in ways that aren't necessarily quite as flashy, but are going to be just as important for being a zoo vet. Yes, and then so at Cornell, one of the ways that I got involved was they have a wildlife clinic there that is primarily student run. So it used to be volunteer basis, now it's like a student job. Exotics early on in my time. I don't know if you guys get any opportunities to do stuff with like OWC through the vet school, but that's kind of the closest parallel that I could draw. And that was really good experience early on because anytime you're working at a zoo, there's going to be a lot of sort of layers of responsibility. And not to say that wildlife aren't as important, but I think that there's a different culture around wildlife medicine, and it's a little bit easier to sort of practice some of those initial skills with wildlife than it is to have someone trust you as like a first year vet student to do things on like a tiger, for example. And then some other zoo things that I got involved in during my Cornell time. I did all three of the aquavet programs, which if you're interested in like specifically aquatic animal medicine or even anything that involves aquatics, I would definitely recommend. I did the first one the summer after my first year, and then 2 and 3 after my second year. The first one gives you a really like well-rounded, like didactic, but also like lab-based, and like you get to visit a lot of aquariums. It's like a 4-week intensive program in aquatic animal medicine that I really enjoyed. And then I also did some research with the Cornell Lab of Ornithology. They have an elephant listening program, despite the fact that it's a bird lab, they have an elephant lab. So I spent some time doing research with them as well. And those were kind of the ways that I got involved in zoo med type things during my first couple of years, but really you're mostly focusing on coursework and all of that. The kind of bulk of your clinical zoo experience will be in your third and fourth year. Oh, yes. Also, I went to Belize, which was kind of a specific thing to Cornell, but a lot of different vet schools, again, depending on where you go, will have relationships with other places and trips and things like that that you can take. So this was one of my Cornell professors, was kind of the vet on record for the Belize Zoo. So every year he would take a group of second years down there, and you would get real like anesthesia experience with jaguars and tapirs and all kinds of things like that. So definitely a good experience. And then third and fourth year, when you're doing your clinical rotations, is kind of the time to get out and go see different places. And definitely I would advise people in the first year or two of vet school to be looking into these, because at this point, these kinds of externships do fill up years in advance. So we take a lot of Ohio State students at the Columbus Zoo right now, but it's, I think, like a year and a half ahead in the cycle of when people are applying. So not to scare you, but it is just something that you should be thinking about and not sort of trying to plan like right before your third or fourth year. If you want to be going to these kinds of institutions that see a lot of students and have these kinds of programs, there are certainly smaller zoos and aquariums that you might be able to get into later on. But I think it's a really important way to make connections. And ideally, if you can find places that, if you want to go the zoo medicine route, if you want to go to the residency route, if you can make connections with places that have those programs, you're going to have a lot better time when applications come around, just because there are so many people that apply, and a lot of times they don't always do interviews. So just having that kind of personal connection with the place can really help you. So I went to the Bronx Zoo, the Smithsonian Zoo in DC, and I also went to the National Aquarium. And case in point, I actually met Katie Seeley, who's one of the other staff vets at the Columbus Zoo at the National Aquarium. She was working there as a staff vet for a year when I was a fourth year vet student, and kind of made that connection. And it certainly helped me in the application process later on. Any questions so far about undergrad or vet school time? You know, it's a lot of information. You guys may also already know all of this, but figured I'd go through those sort of main bullet points. So after vet school, the next step is, for most people, the match. So I would say the vast majority of people that go into any sort of specialization program are going to do a rotating internship their first year out of vet school. You can do a small animal or a large animal rotating internship. I'd say it's most common to do a small animal, but you certainly don't have to if that's not your interest or comfort level. I think this year is very important just for kind of getting your foundations. And most places won't take you for specialty internships unless you've kind of had this first year. So for me, I did my rotating internship at the Animal Medical Center that's in New York City. That's a large specialty referral hospital that has a high case volume, but for me, it was also important that they have a boarded exotics veterinarian there. So I think it's helpful when you're looking into internships to look at a place where you can get a letter of recommendation from someone who's in the field you're hoping to go into. I wouldn't say again that it's necessary, but I think it's definitely helpful. And they also, this program let me do elective time outside of the hospital. So I got to spend a couple of weeks at the San Diego Wild Animal Park, which was also just a nice sort of stepping stone in my education. So after you do your rotating internship, again, I'd say the vast majority of people end up doing a second internship, which will be a specialty internship in either exotics, zoo, aquarium, etc. Some of these programs are outside of the match, but again, the majority of them are inside the match. I would say at this point, probably the only people that are skipping straight from internship to residency are people who are doing combined programs. So there are a few programs out there that are like 50-50 small animal and exotics. And for those people, they've had a little bit more clinical experience with both. So they're a little bit better prepared to go straight to residency. But I'd say the most common path at this point is to do a rotating, and then a specialty internship, and then a residency. So again, this is a 1-year program. I did mine at NC State through their vet school. It was primarily with exotics, but we also did zoo and aquarium stuff as well. And then I ended up staying at NC State for my residency. So zoo medicine residencies, again, for the most part, are 3-year programs. There are a couple of programs out there that are 4 years that include like a master's or something additional. At any given time, I would say at this point, there are about 10 programs available each year, some of which are in the match, some of which are outside of the match. So the OSU program at this point, we have a residency is outside the match. So people apply to that directly and we pick someone before the match. And then the match happens, and then sometimes there are post-match residencies, but not very many. And then during your residency, in order to become board eligible, you have to complete your 3 years of clinical medicine. You also have to publish 3 first author papers that are kind of within the world of zoo medicine. And then at the end of all of that, you get to sit for the board exam. So there's a qualifying and a certifying exam that have 1 day in between them. That happens a couple of months after your residency ends. And you kind of have to take and pass parts 1 and part 2 to call yourself a specialist in zoo medicine. However, it's a hard exam. A lot of people don't pass it the first time around. It's not necessarily going to impact your ability to get a job the same way that it would with like a human medicine specialty, because they wouldn't hire someone and then be like, oh, you didn't pass first time around. Actually, you don't get to be a zoo vet, because there are people out there doing zoo medicine who are not specialists at this point, although it's less and less. So usually if you don't pass the first time, your life goes on as normal in your job, and then you just take it again until you pass. So my residency, the structure was, I spent about 1/3 of my time at NC State at the veterinary hospital in their exotic service. I spent about 1/3 of my time out in Asheboro at the North Carolina Zoo, and about 1/3 of my time on the coast servicing the 3 main North Carolina aquariums. So I got a pretty broad education in terms of the different kind of facets of zoo medicine. But depending on what program you do, some of them are just at one zoo, you're at that zoo all 3 years, and you don't necessarily go elsewhere except for maybe a rotation or 2. Some of them are more academic, some of them are more aquatics focused. So it just kind of depends on what your interests are, and honestly, where you end up matching, just because there are so few programs. But at the end of the residency, when you take the boards, the second day of your board exam is your sort of subspecialty. So you can take the zoo day 2, the aquatics day 2, the zoological companion animal or the exotics day 2, or the wildlife day 2. And at this point, which one you take doesn't really matter in terms of like what jobs are available to you, but that might change in the future. They're getting a little bit more wanting to kind of separate people out based on their subspecialties. So it's just something to know and be aware of in terms of like what your interests are and what kind of career you might want to have. But I do think that there's always going to be some crossover, because of course there's overlap between all of these disciplines. So just because you take one exam doesn't mean that you necessarily can't have a job somewhere else. Any questions on that? So if you don't want a residency or don't get a residency, there is another path to becoming boarded in zoo medicine, and that's called the experiential pathway. There aren't that many specializations in veterinary medicine that allow people to do this, and for now, zoo medicine is one of them that does. So you can, instead of doing the 3-year residency that qualifies you clinically to take the board, you can do a 6-year experiential track, where if you get hired at a zoo or you're working full-time with exotics, like 100% of your time is zoo medicine, you can do that in 6 years. If you're working, say, at a practice where 50% of your caseload is small animal and 50% is exotics, you can do that and still do the experiential pathway, but it's going to take you 12 years instead of 6 years to become accredited. And while you're doing all of that, you also have to find someone to be your mentor who is boarded already in the college who will say like, yes, I vouch for this person, like I'm mentoring them through this process. And, you know, I'm kind of invested in their education and development into a zoo vet. And then the publication requirement in terms of papers is the same. So it can be hard to do research outside of like an academic structured residency program. But if you're motivated, there are certainly people out there who do that. And a lot of people who do this, you know, maybe they do a specialty internship, they don't match. Maybe they do a fellowship or a second specialty internship, they don't match. And they might have some research projects from those, and those first couple years can count towards their 6 years. So when you look at it that way, it's not quite as daunting, but it does take a lot of sort of self-motivation and self-structure to be able to do it this way. And then after you do all of that, you get to where I am now. So I'm a staff vet at the Columbus Zoo. I am also adjunct faculty here at Ohio State, as we have kind of a partnership. We take a lot of fourth-year students and then sometimes come and do lectures like this, but it'll kind of depend on where you work, whether you have an association with an academic institution or not, what the kind of duties required are. But that's kind of the end of that path. So I have some cases to go through. Does anyone have questions about any of that first, or I can certainly answer them at the end as well? Did I scare all of you off of doing zoo medicine? No, okay, great. Okay, well, then I can move on to just going through a couple of recent cases that we've had, just to kind of demonstrate some of the different variety that we see and some of the innovation that's involved in zoo medicine. So this case was a chuckwalla that presented to us for very non-specific changes. So one of the things that we really benefit from in our job is that our keepers know their animals extremely well. So sometimes they can't tell us exactly what is wrong, but they can say like, this is not normal. Even for this lizard, I can tell you that something is off. And we take that seriously because if anyone's going to know, it's going to be these people that spend all day with them. So I think maybe appetite was a little bit decreased. We were a little bit lethargic, but not really showing anything specific. So, you know, what we're always going to kind of start with is physical exam, get some blood work, maybe do some x-rays to see if we can find anything that might be a cause of this. Blood work and everything was pretty normal looking. And then on the x-ray, we have the benefit, again, of working with OSU. So Dr. Hostek, who's a radiologist there, spends 1 day a week out at the zoo with us. And then we'll kind of read our images whenever he gets the chance. So there were kind of some non-specific, strange looking things in the liver that he couldn't really identify. So we decided to do a CT scan on him to get a little bit more detail. Again, we're lucky in that we have a CT scan on grounds at the zoo. Not every zoo has their own CT. A lot of places that don't have them will take their animals to either local vet schools or specialty hospitals. But we were able to just kind of zip him in and out of the CT. And we found this right here. So you can see, this is kind of a cross section, but this bright area here and here is kind of normal bone density. And then you have some of the GI tract with gas in it over here, and then liver right here, which really shouldn't have anything this bright in it. So our suspicion was that it was some sort of foreign body. We weren't exactly sure what it was, but it was enough of a finding that we decided to take him to surgery. Went in there looking, and we actually found what was just like a plastic piece of like fake grass. So he had fake grass in his enclosure. He must have gone to like eat some sort of prey item, ingested that as well, and then it had kind of migrated through the stomach into the liver. So there was like a little bit of like outcropping of intestine that was also like not where it should be. So we resected that, took that piece out, and continues to do great. Next case is Pelican Ken, or his full name, which is Pelican. He lives in the manatee enclosure, and is just a really handsome guy. And he presented to me on the weekend for They thought maybe swelling of one of his eyes, and then they also weren't sure if he was maybe lethargic, not eating. I went to go see him, and while I was doing my physical exam, I found that there was blood on my hands that I couldn't identify where it was coming from. So I opened his mouth and saw that he was bleeding from the roof of his mouth. We couldn't see where that was coming from. So we decided, since he was kind of struggling, to take him up to the hospital, try to anesthetize him and see better what was going on. I got him under anesthesia, and almost immediately he arrested. His heart stopped. We performed CPR, and luckily he came back pretty much immediately. But we kind of aborted all diagnostics at that time for that day, and gave him some supportive care, some fluids, some pain meds. And then I was able to look in there and see that I don't know how much you guys know about bird anatomy, but there's basically like a slit on the roof of their mouth that connects to all of their sinuses, and that's kind of where he was bleeding from. So we used some tissue glue, and some of the like silver nitrate that you might use to stop like a toenail bleeding if you were clipping your dog's nails, to just kind of get it to stop, because there really wasn't anything to like suture up there, and kind of let him be and gave him the night. The next day he was a little bit brighter, seemed a little bit more stable. We gave him some more supportive care. And then we were able to more successfully anesthetize him for more of a workup. So this is a cross-section of his CT scan that we did. You can see eyeball, and then there's just kind of all of this like soft tissue-like structure behind the eye. We weren't excited about like trying to biopsy or stick a needle back there, but talking to Dr. Husnick, kind of our options were he either had a tumor back there or a hematoma, so just like a collection of blood from whacking his face on something in the enclosure. And one of those things we could treat, and one of them not as much. So we decided to treat him as if it was a hematoma. He also had a very low red blood cell count when we did his blood work. So that could be seen with cancer. It also fit with him bleeding from the roof of his mouth. So he spent many days in hospital. We were hand feeding him, giving him fluids, and just kind of resuscitating him. And then a few weeks later, we performed another CT to see if anything had changed. And luckily, almost all of this material had gone away. So I think we kind of assume that it was a hematoma, because cancer wouldn't just disappear like that. And he continues to do great. You can see him out there hanging out with the manatees still. Next case is Cohen. So Cohen, the 3-year-old male koala, who presented sadly on Christmas for what his keepers noticed to be like a golf ball sized swelling on his neck. At first they were thinking, maybe he's about to reach sexual maturity. Is it possible that, male koala larynxes have some sort of development that happens at that age? So they didn't bring it to us immediately, but a couple of days later, they felt it again and noticed that it was getting bigger. So we scheduled him for a couple weeks from then to do an exam, but even just 2 days after that, it was getting even larger. So we decided to semi-emergently anesthetize him for a CT scan to see what was going on. Just based on the region that it was in, our kind of main concerns in terms of what structure was affected was either going to be his thyroid gland or a lymph node. So we went ahead and did the CT. We didn't see disease anywhere else, but it was clearly like a discrete growing soft tissue mass. So we took a biopsy, a sample of it to send out, but just based on how quickly it was growing, we decided we didn't want to wait for the results to come back. So 2 days after that, we took him to MedVet, the specialty hospital, for surgery to have one of their surgeons remove it, which he did great for. He recovered really well. And then, unfortunately, we got the results back that it was cancer. So it was lymphoma, a really aggressive type of lymphoma. And I don't know if you guys know too much about koalas, but there is a koala retrovirus that has been pretty strongly associated with the development of lymphoma in these guys. If any of you guys are familiar with like feline leukemia virus in cats, it's kind of a similar thing, but for koalas. So it's seen in koalas in managed care. It's also in the wild. It's kind of a big deal in terms of its conservation threat to them. And what's tough about this virus is that they all, at least in the United States, they all have it. So it's kind of in the genome. It gets passed down from the parents, and it kind of lies dormant and then may or may not become a problem during their lifetime. And we really don't know why or how to predict whether it's going to be a problem. But historically, once they develop cancer, it's really hard to do anything about it because essentially the virus that's causing the cancer is in their cells, in their genome. But Cohen was a really special boy. He was very sweet and young and otherwise healthy. So we decided that even if we weren't necessarily going to be able to cure his cancer, we wanted to do everything that we could to try to extend his life and give him as long of a good life as possible. So after we removed the mass, we consulted with a few different oncologists, and we decided that we wanted to try him on a course of chemo. So in dogs and cats, lymphoma is pretty commonly and well treated. I don't know if any of you are familiar with the CHOP protocol, but it's kind of a multi-drug protocol that we often use in dogs and cats. And again, although it's not curative, they do tend to tolerate it well, and it does tend to prolong their lifespan pretty significantly. The challenge is, of course, in him being a koala and not a dog or a cat, is that we don't necessarily know what the dosing is that we should be using for them. It's not as easy to just put in like an awake IV catheter and give them their chemo as you would in a dog or a cat. And then there are also a number of drugs in the protocol that are given orally, which for, again, dogs and cats is kind of the easiest part, but for Cohen, who only eats eucalyptus leaves, the very specific, smallest, ripest ones that he likes, getting any sort of oral medication into him was going to be very difficult and really just make his relationship with his keeper staff a lot worse, which was the last thing we wanted at this point. So we did some brainstorming on what would be best practice medically, but also what would lead to the least stress for Cohen. And what we ultimately decided to do was we took him back to MedVet and we placed an indwelling vascular access port in him. So if you know anyone who's been through chemo, a lot of humans will get these, and it's, it goes into a vessel that then goes down all the way to the heart, and then it kind of tunnels under the skin, and there's just kind of a port that you can inject directly into. So you're not messing with trying to get a catheter into the veins every time. It's not as painful or as stressful, and you can just kind of put a needle directly in there to both get blood and administer chemotherapy. So that's what we did for him. And we were able to successfully administer a few different rounds of chemo that way. We did give him like a little bit of light sedation each time we did it, just to make sure that he wasn't too stressed. And of course, we also have to consider human safety when we're administering chemo. You don't want him struggling and anything splashing anywhere, because it's obviously toxic to people as well. But he did really great. He tolerated his treatments well for a while, but then unfortunately, as it does, the cancer progressed. And we ultimately euthanized him. But it was a cool case in that everybody, from the oncologists to the vets to the keeper staff, worked really hard to figure out what was going to be the best treatment plan for him, both in terms of medicine and then also just in terms of giving him a good life for as long as we could. This is a case from today. I added this one in last minute just because it was cool. We did anesthesia on an ostrich named Midge today to look at her feet. So ostriches are fun in that, they're birds, but they're also kind of horses. So they kind of stand on this one digit like a horse does, and she's 300 pounds, but she's also a bird. So they're kind of a weird species to work with. We don't anesthetize them very frequently because it is challenging and comes with a number of risks. But Midge has had kind of a curling toe for a long time. She probably like luxated one of the joints a long time ago and maybe has some like twisting tendon that doesn't let it be in full alignment, which we were able to manage for a long time with just pain meds. But, you know, as it gets worse, as she gets older, we decided that it was worthwhile to get hands on her to do x-rays and see if there's anything else that we could do. You know, again, in small animals, you might be able to fuse that joint together or put a plate there. But just in terms of the sheer amount of weight that she's putting through that foot, it's a lot more complicated to decide the pros and cons of whether that's going to be a good treatment plan for her, even if that's kind of the standard of care in other species. So this was kind of ongoing. We got hands on her today. This is not her radiograph, but just so you can see what an ostrich foot x-ray looks like. This bird also has some changes to her digits, so it's not the worst picture to put up there. But we were able to get some good images of her. We had some large animal surgeons come out and consult with us and take a look while she was under. And then we gave her a treatment of platelet-rich plasma. So we took some of her own blood and then spun it down so it was mostly platelets and other growth factors that can help with healing, and then went ahead and injected that back into the joint. So this is something that can be done in any species, but it is often done with large animals to help kind of stimulate healing, because you don't have a lot of vascular supply to those joints, and they're not necessarily going to get the like good inflammatory mediators in there otherwise. So we'll see how it works for her, but it's kind of a cool and experimental thing to be a part of. Yeah.
So I presume you guys specialize more in certain species, or do you just take whatever need?
Yeah, it's a good question. At our zoo, no, we all do everything. There's certainly every vet kind of falls into things that they like more than others, but we try to really spread things out evenly and make sure that everybody gets to do everything. So the way that we do that is that we have different receiving days throughout the week. So if Wednesday's my receiving day, then any new case that comes in is mine for the day, and then I follow it through so that we kind of all spread the love and there isn't like preferential anything. But yeah, so we keep it very even amongst us, but it will depend. If you work in a zoo, sometimes people do get more species preference, and certainly a lot of people do like research and conservation projects and things like that, and that will often be like focused on whatever your interest area is a little bit more. Next case is Fergie the fox. So she was about a I think 12-year-old fennec fox who presented to us for a small lump, again, that her team had found just handling her normally. It felt like it was associated with her mammary gland, but it's a little bit hard to tell for sure just based on her exam and her scan. So we went ahead and got a sample of it with a needle, which came back and said, yes, it is mammary tissue, but it couldn't say whether it was cancerous or not. So we decided to just go ahead and remove that mammary gland just to be on the safe side. And we were glad that we did, because it did actually come back as mammary carcinoma. So she did have breast cancer, essentially, which in an animal that small, your kind of treatment options, again, are somewhat limited. So when you take out a cancer like that, what you're hoping for is that it comes back with clean margins. Fortunately, hers had dirty margins, which extended into the deep margin, which was essentially her body wall, which was about 2 millimeters thick. So in theory, when you get dirty margins, what you want to do is go back and do a surgical revision and take more tissue until you get to healthy tissue to make sure that you have everything. But that wasn't really an option in her. And we also faced the challenge of, you know, do we treat her more like a dog or do we treat her more like a cat? Because as you'll learn in vet school, mammary tumors in general behave very differently in different species. So in dogs, typically They're locally aggressive. If you get rid of that one tumor, they often will do really well. Whereas in cats, for whatever reason, there's a lot more communication between the mammary glands. And even if you excise that whole tumor, they're really likely to have tumors pop up on other glands along their body. So if you have a cat with mammary carcinoma, the recommendation is to take the entire mammary chain, not just the mammary gland, which again, she was about 3 pounds and really at the end of her lifespan. So we talked about doing that, but because we didn't know how it was going to behave or kind of what her recovery would look like, we decided not to do that. We talked about whether chemotherapy would be a reasonable option for her. But there aren't a lot of good chemo options for mammary carcinoma. It's one of the tumors that just doesn't respond that well. So our other option that we were left with was radiation treatment, of which there are a couple different kinds. So there's the kind of radiation treatment where we would take her, multiple times, like once a week. She would need to be fully anesthetized. She'd be under for about an hour, and they would target and do all kinds of physics and math that's well beyond my scope to radiate the cells that are left there. But there's also a treatment called strontium therapy, which is kind of a one-time treatment where they have the radioactive metal basically in a box that they will take out and just place on the scar where the tumor was removed. And it's enough radiation in one dose that you don't have to do it again. And it's very local. So it's best for tumors that take up a small amount of space and don't penetrate very deep, which was kind of exactly what we had going on with Berkey. But ultimately, that's what our team decided to do. We took her to Ohio State, and they very kindly donated their time to give little Fergie her radiation therapy. They told us that typically what you'll see is like a couple of weeks after they'll develop this kind of big ulcerative wound that will then heal because you're basically killing off all the rapidly dividing cells there. She developed like a very little scab, but I think it's just kind of interesting and demonstrates that there's a lot of species differences even in an animal that kind of looks like a dog, and that she really did not have that kind of expected reaction that you would see in a dog or a cat. They're desert species, and I feel like they're just resistant to a lot of things that our little domestic species are not, so they just tend to be hardier. But she tolerated it extremely well. You honestly wouldn't know anything ever happened, and did well again for a time. The cancer did ultimately come back, but we gave her about it was like 6 or 8 months of good time before the tumor started to regrow, and we decided to euthanize her, which, a sad outcome, but, ultimately fennec foxes live to be about 11 to 13, so giving her an extra 6 to 8 months was a pretty big thing for her and for her caretakers as well. All right, next case is Stubby. How many of you guys know Stubby? Okay, it should be everybody, but that's okay. So Stubby, or as we refer to her, the queen, is the matriarch manatee at the Columbus Zoo. So her job, her purpose in life is to raise the little baby manatees that we get. So we are part of the manatee rehabilitation program. So about once every year, we have little baby manatees that come up from Florida that have been orphaned, rescued, and had kind of the beginning of their rehabilitation journey, usually down in SeaWorld or Zoo Tampa or any of those kinds of places that will take them in, make sure that they're stable, and then they come up to us. They spend a year eating, getting fat, living their lives, and then at the end of that time, if they've gained enough weight and they're still healthy, we send them back down to Florida and they get released back onto the wild. So it's a cool program that we're a part of, and we really couldn't do it without Stubby because she kind of teaches the babies how to be manatees. We try to be as hands-off with the babies as possible because, again, we're going to be sending them back out into the wild, and we don't want them to have positive associations with humans that'll put them at risk down the line. So she really becomes their parent. She loves them. We have to give her a little bit of anti-anxiety meds every time the babies leave before the other ones come back because she gets sad. So she's great. We love her. But she is a very sensitive flower. So as you might notice with her coloration, she's had some skin issues in the past. This is part of why she's non-releasable. She's called stubby in part because of the tail here, which was probably an old boat wound. But these kinds of white lesions here are from various episodes throughout her life when she has developed these kind of ulcers and sloughed off her skin. So we think that this is secondary to a latent herpes virus infection. There is a manatee herpes virus that they kind of, once they have it for life. And it's kind of one of those things that will flare up when they get sick or stressed. So we think that's where those lesions came from. And she's had a few episodes of having that flare up in the past, but the last one was probably about a decade ago. So she's really been cruising, living her best life. And then a few months ago, something in one of the alarm systems in her habitat malfunctioned and went off for a few hours in the middle of the night. She got very stressed by this, stopped eating, and then we think just kind of the cycle of stress and not eating had this flare happen again. So she developed all these skin wounds. She started sloughing off a lot of her skin, and she was just simply refusing all food. Yeah.
So when it's flaring up, is there a possibility?
It's a good question. I think it's possible. We've never seen any of them get clinical disease from it. And I think it's one of those things kind of, like herpes and a lot of other species where they may already have it. It just might not be clinical for them, but it's a good question. We don't know. So in this occasion, again, this is what we think is happening, but it's not to say that something else couldn't be happening with her. There's a lot of challenges associated with doing any diagnostics in a 2,000-pound animal. But thankfully, we have a kind of system set up there. So there's a chute in the back of the enclosure that she will swim into. And as you can kind of see here, she swims into the chute. We lock the doors, and then we lower the water level until she's on the ground. We can get in there with her, do whatever treatments that we need to do, and then raise the water level and let her back out. So it's pretty minimally stressful. Sometimes the divers have to swim around and kind of convince her to go in the chute if she doesn't feel like it. But as she showed us many different times, she can always opt out if she chooses to. So for this instance, we were getting hands on her, doing blood work and treating her almost every day. We were passing a tube into her stomach to give her fluids, to give her basically a kale smoothie, to give her the kind of nutrition since she wasn't eating, as well as some ground up biscuit-like material that has a lot of different vitamins and minerals in it. And then she was also getting antibiotics. She was getting antivirals. She was getting pain meds, basically anything that we could do to support her through this. And we did see changes on her blood work and that, kind of indicated inflammation, but we didn't get anything specific that showed a cause. So we just kind of continued to support her through it. We were doing all kinds of topical therapy. We were doing laser therapy on her wounds to try to help them heal. I think part of it too is once this process starts and she has these ulcers everywhere, she's painful, she doesn't want to eat. And then that just kind of makes everything worse. Her gut slows down. So it was a long process, but after I think 45 days of her not eating anything and us kind of giving her all of her nutrition, one day she just decided to eat again. And she's been doing great ever since. So, sometimes we don't get answers, but we all really put in the work to get Stubby healthy again. And we really hope that she doesn't decide to do this again anytime soon. Well, I believe she's in her mid-20s, and I think they can live into their 40s to maybe 50 at the outset. So she's not young, but she also could live easily another decade or so, we hope. Yeah, so those are the cases that I had, and then I also just kind of want to highlight at the end, some potential research type things that you guys might get yourself into if you end up going the zoo med path. So these are just a couple of the ones that I did, but this was a paper that I did on intraocular pressure in brook trout. This is one that I started when I was an extern at the National Aquarium. So I put this in here just to kind of highlight that there's so many species and there's so many species differences out there that one of the nice things, it's nice when you're trying to do research, it's a little bit infuriating when you're trying to practice medicine, is that there's so many normals and things that we just don't know at this point. So there's endless opportunities out there for different projects and different species of things that, you know, are very well established in domestic species. I also wrote a paper on treating, again, lymphoma in bearded dragons. So again, common diseases, but in uncommon species where you kind of have to work around different challenges with their physiology, challenges with delivery of drugs, things like that. There's a lot of creativity involved in both doing zoo medicine on day-to-day, but also kind of the research aspect of that as well. And then, you know, what I think a lot of people enjoy and find the most fulfilling is the sort of conservation research that you get to do. So this was me down in the Galapagos. The third year of my residency, I got to go down and do health surveys on lava gulls, which is the most endangered gull in the world. There's only about 300 of them left. So even though it was just kind of getting some basic information on, you know, what their health status is, doing stuff like that is always very meaningful and a lot of fun. And that gets to be part of your job. So to kind of sum up, pros of zoo medicine, every day is going to be different. You get to contribute to the preservation of wildlife, and then there's always going to be opportunities for getting involved with, you know, One Health conservation projects, as well as maintaining good public health. You get to be proficient in all taxa, so you really become like comfortable with being uncomfortable all the time. I think a lot of specialists get so narrow in what it is they do that they're really great at a few things, but with zoo medicine, you have to be pretty good at a lot of things. So if that's something that you're into, it might be a good fit for you. And then of course, the last pro is that your patients are extremely cute. But the flip side is, you know, including undergrad and vet school, it's 8 years of school. And then on top of that, you have about 4 to 6 years of postdoctoral training, if you're lucky. And it certainly comes with a significant financial investment, both in vet school and then also accounting for the fact that you're just not going to make a lot of money during those first several years of training. So, you know, although it's not something that people talk about a lot up front, I do think it's something that people have to consider in terms of their career path and whether that's something that's going to be feasible for them. Depending on your residency, you may have a lot of travel. So in my residency, I had the 3 different locations that I was bopping between. It wasn't structured as if it was like a year. I was like kind of bouncing between them every couple of months. So you don't really get to set down roots during that time. It can be hard to maintain any sort of real work-life balance. Again, every residency is different and not all of them are quite as chaotic as mine was, but these are just all things that you want to consider when you're deciding whether you want to go into this field and deciding what residency program might be a good fit for you. There's also a decent amount of fluctuation in the job market. So it used to be that you kind of had to wait for someone to die or retire in order to get a job in zoo medicine. I would say that's not the case anymore. I think COVID really shook a lot of things up. People decided that they didn't want to live the sort of overworked, underpaid lifestyle that they were. So a lot of zoos either lost people or got new positions to kind of help spread the workload out, or both. So I think in the last several years, there have been a lot more jobs available, but it is kind of a fluctuating live thing. And if you're someone who wants to work in a specific place, zoo medicine, or at least working in a zoo or aquarium, might not be for you, because there's going to be at any given time maybe one job available in that one city if you're lucky at that time. If you want to work in pet practice, if you want to do exotics, you're going to have a lot more options because there's going to be private practices in a lot more places. But if I wanted to live in Columbus, and you know, I'm not leaving my job anytime soon, I don't think my colleagues are, like there's not going to be a job at the Columbus Zoo, so there's really not a job in zoo medicine in Columbus until one of us decides to move on or we add a new position. So that's just something to consider if you feel like you're tethered to a geographic region in the long term. And then, of course, the board exam sucks. And you also just have to consider that there are a lot of politics and things like that involved both internally and externally with being a zoo or aquarium vet. It's a little bit more public facing as a role than you might be as a veterinarian otherwise, depending on what career path you take. But I will say that the sort of the flip side of that is that you don't deal with clients as much. So depending again, like what your tolerance is for different kinds of human interaction, it might be a good fit or it might not. And with that, I'll take any other questions you guys have. I was not. So I finished my residency about a year and a half ago. So I just joined the zoo team. My position actually was a new position. So they had finished recording all of that by the time I got here. There were rumblings of whether it might start again, but I think the answer is no. But Katie and Priya and Randy are all the people that I work with. So yeah. Yeah. No, it's a great question. So for people on Zoom, the question was, how do you do just a baseline physical exam on a zoo animal if it's a large animal, or even if it's not a large animal? A lot of the animals that we have, they are, a lot of them are very willing to participate in certain behaviors, but that doesn't mean that they're going to let a stranger just like manhandle them all over. So I do think that that is one of the biggest challenges of being a zoo vet, in terms of if you're someone who likes to make decisions based on knowing a lot of information, then it is challenging. So we kind of have to take into consideration, what are the risks, what are the clinical signs that we're seeing? Do we need to get hands on the animal? Will the animal allow us to do any of those things awake? And if the answer is no, we just have to anesthetize them. So we do a lot of our physical exams under anesthesia, which allows you to do a lot. And we kind of tend to sort of, we're rarely going to anesthetize an animal and just like do an exam. When you kind of make that decision that it's worth the risk, you're usually going to be doing an exam, you're going to be doing blood work, you're going to be doing imaging of some kind. You're going to be giving supportive care for what you think might be going on to kind of give yourself as much bang for your buck as you can. But depending on the species, there's always going to be limitations, right? Like I'm not going to ever be able to do as detailed an exam on a shark as I can on a fennec fox. The elephants, they will let us touch them, but you're never going to be able to do an abdominal palpation that's going to mean anything to you on an elephant. So we work with a lot of unknown. We rely a lot on our keepers telling us, like what is normal and what is abnormal for what they're seeing. But yeah, there's a lot of times where we just can't know, especially with the like biggest animals. I will say that at the Columbus Zoo, our keepers work really hard to train a lot of medical behaviors in animals. So we can do a lot of awake voluntary blood draws in species that you might not be able to otherwise. A lot of our animals will present themselves for voluntary hand injections. So we can anesthetize them in a pretty non-stressful way, or we can give them like, a hit of an anti-nausea medication or a pain medication and kind of say, okay, like we'll give you a day, and if you're not better tomorrow, then you get an anesthesia and we see what's going on. So they do a lot of work to make it so that we can kind of stage our intervention, but there's a lot of sort of gut and saying like, is this something we need to do right now or not? And sometimes you're right and sometimes you're wrong. And of course, there's also the complicating factor of like, a lot of animals will do things for you when they feel well, but when they don't feel well, they might say, no, thank you, I'm not going to come up and give you my blood today. So you kind of have to do the analysis again of like, what is my concern level and what is my level of intervention based on that. It's hard. Yeah. That's hard. Favorite or least favorite species to work with. I mean, I think my favorites are just like whichever patients I'm spending a lot of time with right now. So like, and it depends on the situation too, because like I love Stubby. I'm always happy to spend time with Stubby, but like by the end of 40 days of tubing her every day, I was like, I wanted for her sake for us to not see each other for a while, you know? So I think it's complicated. But I like just kind of, yeah, just a variety of species. I like otters, I like penguins. I like koalas a lot now after I worked with Cohen so much, but I feel like you also just develop relationship with like individual patients. And least favorite, I'll say rabbits. Spent a lot of time treating rabbits during my residency, and I would be fine to not do that again. Yeah. Yeah, so a lot of breeding recommendations kind of come down from the SSP or the species survival plan, and they will move animals to different zoos in order to like make those things happen. And then we are kind of involved on the medical side if there's a problem or to kind of support the pregnancy as it goes on. So we don't do as much of the like planning for the breeding. There are some zoos that like the Smithsonian that do a lot more like electroejaculation, like saving sperm and doing research and sending sperm elsewhere. We don't do a lot of that at the Columbus Zoo, but I think it kind of depends on where you go. But like, for example, you know, we have a sloth bear named Heidi who keeps seeming like she's pregnant, but she's not. So we go down and ultrasound her, I think about once a month now, and she like sits at the bars and she gets her like spoon-fed guacamole while we ultrasound her, which I think at this point she just enjoys and she's never going to be pregnant. But yeah, we help with stuff like that, and because we don't know if there's a fertility issue there or not. In the coming weeks, we're going to do an anesthesia to do like a full repro exam on both bears. So that's the kind of time that we tend to get involved, or when we have like babies born and they need extra care, we're involved in that. But otherwise, we kind of leave it to the animals. Yeah. Yeah, it's a good question. So we do our population tends to skew geriatric because the animals do receive, they have a safe life and they get a lot of medical care that they wouldn't get out in the wild. So part of being a zoo vet is that you see a lot of old animal problems. So that's something you have to be cool with. You're going to see a lot of arthritis. You're going to see a lot of tooth disease. You're going to see just a lot of kind of general decline. So, I mean, I think that's part of why we see more like cancer at the zoo than we would in like a wild animal, because probably the minute they start feeling unwell, like something's going to predate upon them and they're just not going to be alive anymore. So it gives us opportunities to see diseases that haven't necessarily been reported before in those species and try novel treatments. But I think it's also always going to be a balance, because it is harder to make those decisions, those like quality of life decisions, when the animals are just kind of getting older and like medically we can support them, but at what point, you know, is their life just not as full as it used to be? So I don't know if that answers your question, but we do see a lot of old animals and it's a good thing, but it comes with its own set of challenges. Yeah. Yeah, it's a good question. So we do have a preventative medicine program at the zoo. So we have, I think they actually just did the census as of a month or so ago. We have about 6,000 animals at the zoo. So we can't, and that includes things like fish, right? So some of them you're not going to do a thorough exam on. So we don't get to every animal every year, but we do have them on like a rotating basis based on kind of what our concern level is for that species and their age. So it might be, you know, all of the Columbus monkeys get a full anesthetized physical exam every 3 years. And then if, they need anything before then, we'll do it. But some animals have more health problems. And so we do make sure that we get hands on them once a year. I think it's also somewhat of a calculus based on just like risk and what we can do hands-on. So like the okapi might get an exam once a year, but we're not going to anesthetize them once a year if we don't have to, because they're just a much higher risk species in terms of their anesthesia, and the information we're going to get from doing a healthy exam doesn't outweigh what could potentially go wrong. So we do have a sort of built-in schedule for everyone, but it fluctuates depending on what the species needs and all of that. Anything else? Yeah, thank you guys.
Do you mind staying like 5 minutes, please? Okay, sure. Well, thank you guys all so much for coming. Sorry I couldn't be here at the beginning. I have 23 graduation going on. But thank you all for coming. Thank you guys for such a great year. I think we've had so many fun things this year that we don't usually do. So that was really fun, really interesting meetings this year. So thank you all for being part of PVMA this year. If you need anything, I will still be here across the river. A lot of the EG will be here still, so you know where to find us. Just a reminder, we do have merch if you ordered it. For the semester, you can get that picked up from Michaela. So yeah. Yes.
Okay, I would like the survey, so I'm really sorry about that, but Jeff wrote me group me also make sure to email, but please give me your feedback so I know what you guys are considering next year or additional meetings, please. Also, a group of us is going to Smash Burger after this, so if you want to go and help with a fundraiser, just stick around. We'll be somewhere around here. We can all head over to group.
Tell them that it's for the fundraiser before you order it, or else they'll get it. Because I'm ready. But yeah, and also thank you to all who went to our banquet last night. It was a lot of fun. But yeah, you guys are free to go. Thank you guys so much for a great year. Live on what you're doing.
I could think of like fine.